the Royal Society and a Nobel Prize-winning biologist. He sits on SAGE advising the government and has set up a group called DELVE, Data Evaluation and Learning for Viral Epidemics. They've produced a paper on the use of face masks, something we're all going to be thinking about over the next few weeks. When I talked to him a little earlier, I began by asking him whether wearing them was going to become a permanent feature of our daily lives.
Nothing is permanent, but I think it's going to be quite a useful tool to tackle the pandemic. Remember, the virus can be transmitted by a variety of routes. One of them is through our exhalation of droplets. These droplets could be directly inhaled by others, or they could land on surfaces that we touch and get contaminated by. And we want to block all of these routes. But there are conditions where you cannot distance yourself, for example, in public transport or in crowded spaces, or indeed in certain work spaces where people occasionally have to come together. And so if we want to emerge from the lockdown, we need to block all of these routes.
Can I just ask you to be clear? Wearing a mask doesn't protect the mask wearer so much as the people around the mask wearer. So in a sense, it's an act of altruism to wear a mask.
It's altruism only if you look at it very narrowly. If all of us wear masks, we all protect each other, and therefore we protect ourselves. So you can think of it as a sort of cooperation, that makes us all a bit safer.
Because some people are worried that wearing a mask increases the viral load. In other words, you're exhaling the droplets and immediately re-inhaling them and making yourself sicker.
Oh, that is simply not really a valid objection. I mean, if you're already infected, you're already full of virus. So the fact that you're exhaling them and re-inhaling them doesn't strike me as reasonable. And moreover, remember that droplets are going to be captured by the inside of your mask. You're not going to be re-inhaling them anyway, but, it simply doesn't make sense, that argument.
Let me ask you about another objection to this, which is that it will give people a false sense of security and encourage them not to do the other things like washing your hands and maintaining social distancing. There was a letter in the BMJ suggesting just that this week.
Yeah, I'm afraid there's absolutely no evidence for that. In fact, all of the evidence is that if you wear a mask, you're more aware that there is a problem that you have to deal with. And the very few studies, there are no really good studies, but the very few studies actually suggest that you might, in fact, be more careful rather than less careful. I'm afraid this is simply hypothetical, and the reality is that there are millions of people wearing masks in many, many countries, and there's not been a surge of infection. In fact, most of the mask-wearing countries have a lower transmission rate.
So we're told that at the moment we shouldn't be wearing, as it were, clinical masks there for NHS professionals. We should be making our own in many cases. Can I ask you, out of what? This government talks about using T-shirts to make them. Other people have talked about the material used for hospital curtains. President Trump suggests wearing a great big scarf is the best thing to do. What's your clinical view?
I'm not an expert on this, but this really is an area where material scientists and clinicians can help. I think we need to standardize fabric and we need to standardize design so that we have good breathability along with good filtration, and we also limit the amount of droplets that escape out of the sides of the mask. So these are legitimate issues, but I think these are not issues that need to take much time to standardize on. And in fact, your own BBC website has some ideas of how to make masks. So there are lots of efforts going on in this sort of avenue.
There's a big controversy at the moment about when schools will return. Do you think teachers should wear masks?
Well, I think anyone in public spaces should wear masks because it's simply another tool to reduce the possibility of infections. I don't think the masks are an end-all and be-all. You have to think of it as one leg in a sort of multi-legged sort of stool that holds up prevention of transmission.
You would like this tool to be used more, I think, At the moment, the government is not advising teachers to wear masks. Do you think they should?
Well, it's very hard. I mean, if they're socially distanced and there are all these other measures in place where the use is not necessary, that is a policy decision. That's not for a scientist like me to say. I think my view is that whenever social distancing is not possible, we must regularly wash our hands, and I think it would be a good idea to wear masks.
Now, you're a member of SAGE, you're advising the government. According to your understanding of the rules, do you think Dominic Cummings did anything wrong?
This is, again, not a scientific issue, and I should say one thing. What individual people do and what science and policy is are two entirely different things. What I want the public to be sure about is no matter who, may be at fault personally, the policy should be based on evidence, and the evidence suggests that we should be maintaining distance from each other. We should not try and prevent routes for transmission. So I don't want to get into the specifics of what Dominic Cummings did because, different sides seem to have different views on that, on what he actually did.
Sure.
And I am sure that in due course, when the facts are fully determined, the matter will take its course. But as a scientist, I want to focus on trying to prevent transmission. That's sort of the goal of scientists.
Well, let me ask you directly about the science during this crisis, because various people, including the former Health Secretary Jeremy Hunt, have been highly critical of the scientific advice. Let me read you what he said on the 11th of May. He said, "It's now clear that a major blind spot in the approach taken in Europe and America was our focus on pandemic flu rather than pandemic coronaviruses. The failure to look at what the Asian countries was doing at the outset will rank as one of the biggest failures of scientific advice to ministers in our lifetimes."
I am not sure. First of all, I was not privy to what was going on because I joined SAGE only about a month ago. But you have to remember that science advice is only one part of what government policy is. What government policy eventually ends up being depends on a number of factors, the advice they get from scientists and various problems with implementation, political considerations, etc. And you can see that the facts about the virus were known, the same facts were accessible worldwide, yet many different countries, from Sweden and the US and Britain to New Zealand and Taiwan, have all had completely different, well, not completely, but they've had distinctly different responses to the same scientific questions.
As president of the Royal Society, are you a little concerned that in the blame game, as it were, scientists are now being blamed rather than politicians?
Scientists are working flat out to help with this pandemic. What they don't want is when faced with very uncertain facts that are rapidly emerging, and they're giving their best advice at the moment, what they don't want is to be blamed or found culpable in hindsight when more evidence comes along and the evidence changes. So that would be a very bad thing. But it is reassuring that that at least number 10 has recognized that. And, scientists should feel comfortable about giving frank advice. Otherwise, they will, if they're not encouraged to be frank, that's really bad in terms of moving forward.
Sir Venki, it's been a fascinating and refreshing conversation. Thanks very much indeed for joining us this morning.
Thank you.
So this is what